Well, today we are focusing on women's heart health, and joining us now is Dr. Lisa Freed, the Director of Women's Heart and Vascular Program at Yale-New Haven Hospital, along with Dr. Lavanya Belumkonda, a cardiologist at Yale-New Haven Hospital. Thank you both for joining us. We got the memo, wear red.
Got the shoes.
What
do you ladies think of that, huh? Whole other level there, huh?
In homage to, I do want to know, especially since I myself am a woman, the last time I checked, how common is heart disease among women?
So heart disease is actually the #1 killer of women, and more women than men die in the United States every year of heart disease.
Why is that?
Well, it's the risk factors that women have is a high prevalence of hypertension, which is high blood pressure,
Sure.
Hyperlipidemia, which is high cholesterol, a high rate of smoking, high rate of obesity, and a lack of exercise.
And this is more prevalent among women than it is among men? All of those factors that you just mentioned.
Some of them are. Hypertension is more prevalent, diabetes is more prevalent, obesity is more prevalent.
Now, how about some of those warning signs, things that oftentimes you feel in your body, but a lot of times we say, now I'll wait a week, or I feel okay. How should we react to these things?
So women usually present a little differently than men when it comes to heart attacks, and the Wear Red Day from American Heart Association is to increase the awareness of heart disease in women and make them more aware of the symptoms that most of us think of heart attack as chest pain going down to the left arm, but in women, not infrequently, they present with back pain, jaw pain, shortness of breath, and things of that nature. And a lot of times I've had a patient who had a jaw pain for 3 days and chalked it off to toothache or dental pain and kept seeing her dentist. And then she presented with cardiogenic shock. Her heart wasn't pumping, she had a major heart attack.
Wow.
So this needs more.
That makes it very difficult, because it's anything from a shooting pain to, oh, maybe I have a cavity. That has to be incredibly difficult for the medical community. What strides have you made, knowing that there is no clear-cut delineation between what the symptoms are? How do you deal with that?
It's actually most important is listening to the patient's story and hearing what the pattern of the chest pain is, or the jaw pain, and how it is presenting, how often it's happening, how severe it is, and we sort through their symptoms and try to come to a reasonable conclusion. There's also lots of testing we can do to try to sort it out. If we think someone's having an acute presentation, we'll check something called cardiac enzymes, which are in their blood,
Sure.
And that's done in the emergency room.
I wonder, how early can heart disease present itself? Teenagers, young children, you know?
We know that atherosclerosis starts from a very young age, which is why there is a big push by the American Heart Association to have good diet and exercise in children. But the actual acute presentations, for men, it's generally over the age of 45, and for women, over 55.
Very useful information, not something that we always think about on a daily basis, so thank you for enlightening us on this topic. We greatly appreciate it. And we have even more information coming up here on the show, but we want you to head on over to ynhhs.org/smarthearts for a little bit more information. Doctors, thank you so much for joining us here today on CT Style.
Thank you.
We appreciate it.
Great having you. And our heart health